Hi, I'm Dr. Susan Rich. Whenever I started writing the Silent Epidemic, A Child Psychiatrist's Journey Beyond Death Row, I imagined being able to just tell my story and my concern about the fact that prenatal alcohol exposure has led to brain damage in up to 1 in 20 children in this country. And when I first learned about this at the age of about 26, I was devastated. I couldn't believe that I had gone so far in my education, being the first in my family to graduate college, and no one had ever told me up to that point that prenatal alcohol exposure can cause problems even as early as the 3rd week after conception, before most women even know they're pregnant. And since about 50% of pregnancies in this country are unplanned, with as many as 13.5% of childbearing age women binge drinking, it was shocking to me that so many women could potentially be exposing their babies to alcohol and not even know they're pregnant. So looking around, I saw warning labels on bottles, and some states actually even have passed laws saying that you shouldn't drink when you're pregnant. But both of those, both the labels on bottles and the most of the posted signs where liquor and alcohol is sold, indicate that pregnant women shouldn't drink because of the risk of birth defects. The problem is most birth defects happen in those very early stages of pregnancy, before you even know you're pregnant. So as a young woman, I began to ask people whether they knew anything about this, and many people didn't. I also started to ask policymakers and legislators in the state of North Carolina whether they knew anything about children with fetal alcohol spectrum disorder. And all the way back in the 90s, when I was asking these questions, people really didn't seem to know much, and those that did just kind of brushed it off and said, that's just how things are. Yes, some babies are going to be affected, but others aren't. And I started to look into where these children were in our society. And one very astute man, who was at the time, I think, head of the Division of Juvenile Services, the Administrative Office of the Courts, Division of Juvenile Services in the state, said that he believed that I would find a lot of them in juvenile detention centers and training schools. So I started looking into that with my Master's of Public Health thesis, and looking into the literature on prenatal alcohol exposure as it related to juvenile delinquency. And what I found was that all the way back into the 1950s, people had done research looking at the link between learning disabilities and cognitive problems with risk for juvenile crime, juvenile delinquency. And knowing that prenatal alcohol exposure is a leading known and preventable cause of cognitive and neurodevelopmental issues, then it's only natural that you can appreciate that prenatal alcohol exposure, because of neurocognitive problems, would be linked to juvenile delinquency. The other linkage is the fact that many women who use alcohol are coming from domestic violence issues, and their children are going to be exposed to that. So not all women that that use too much alcohol are coming from domestic violence situations, but many of the women do. And for their children, then their children end up with not only the neurodevelopmental problems that they had from the prenatal alcohol exposure, but they end up with trauma from witnessing or experiencing abuse. And the trauma combined with the neurodevelopmental problems associated with prenatal alcohol exposure then leads them to have a higher risk for violent and persistent crimes. So one of the chapters in my book is actually about Adam Lanza. That's chapter 1, and just showing the linkage between prenatal alcohol exposure and witnessing or experiencing abuse and violent and persistent crimes, looking at Adam Lanza as a potential example of how this could happen to an individual. In his case, it's not clear that there was any abuse or neglect, but he indicated that he had been bullied at school because of his neurodevelopmental differences, and he also had a mother who was a heavy drinker. So knowing that this problem happens even before women find out they're pregnant, and knowing that many women don't know they're pregnant until it's already too late, as well as the fact that children have different risk factors from genetic perspectives, then they may be at risk of having violent and persistent problems with their neurodevelopment. Consequences related to the violent, persistent outbursts. And it is way more complicated than I'm explaining, but there is a linkage, and looking at the research, it's important to take a step back and say, what is the original cause of all the problem? And for many kids, it is prenatal alcohol exposure, and we can do something about that by having women contracept before they even get pregnant if they're using alcohol. So I want to continue this reading of my book, and every time that I read a few chapters, before I do that, I will have kind of an overview. And I'm also hoping to start a live streaming so that I can answer questions and get feedback from people to see how we can spread this message more globally, because these children can be helped. I am a child psychiatrist. I see these children almost every day of the week, and I've been following many of the children for a number of years. Some of my patients are adopted from Russia, the Ukraine, Eastern Europe, countries like Lithuania, Romania, Bulgaria. I have some that are adopted from Southeast Asia, foster care in the U.S., South America, Central America. So I'm not alone in this work. There are many, many other very highly talented people that are doing research, that are, some of them working with kids in detention centers and training schools, others going to death row and seeing these individuals, many educators, many psychologists who are doing groundbreaking research on how to help the children academically, socially, emotionally, and in other ways in their neurodevelopment. So I just wanted to kind of put this channel out there so that I could get the message out to even more people. I've been really glad that people really all over the world have begun reading the book and giving feedback. I'm very inspired by that, and I think that we can continue this message by having this channel. So that's why I'm doing it. Thank you for listening, and please give me feedback. Let me know what more I can do, what more I can talk about, and I'll be very happy to do that.